Hello, my name is Ravi Vij. I'm from MyCancerHaven, and today in the Conversation with Cancer Experts series, I have with me one of the thought leaders in myeloma, Dr. Brea Lipe, who's professor of medicine and directs the myeloma program at the University of Rochester in New York. And we're glad to have her today to talk about a topic that is very contemporary, and we just have started having data emerge on sustained MRD negativity. Welcome, Bria.
Thank you so much for having me. It's great to be here.
So, Priya, so I guess we've talked about sustained MRD negativity in myeloma for a while now. To set the stage, what is the definition of staged MRD? What is sustained MRD negativity?
So, that's actually a good question because it's something that has evolved over the years as we've gotten better technology. And so MRD stands for minimal residual disease. And that's basically how deep of a remission someone has achieved. And at the very deepest molecular levels, how much disease is left. So with the MRD testing that we have available now, we can actually detect up for some patients up to a level of 1 in 10 times 1 times 10 to the negative 6 cells are not cancer cells in a bone marrow biopsy. And what we know is it used to be 1 in 100,000, then 1 in a million. So we're just getting better and better at detecting those very low levels of disease. And we find that that correlates with outcome, so that the less myeloma you have, the better you do overall. But now some of the most recent emerging data is not just achieving that MRD negative status, but can you keep that MRD negative status? And that is better able to help us distinguish amongst patients their risk stratification, how best to treat them, and guide them moving forward.
So it seems like at the ASCO meeting, for the first time from large prospective studies, we've started getting some data on what sustained MRD levels we are able to achieve. So it'd be great for you to go over this for our audience. So the first study we're going to talk about is the Perseus study. For those who are not familiar with the study, could you just briefly tell us what this study was doing?
So this was a study for transplant eligible patients, and it randomizes patients to bortezomib, lenalidomide, and dexamethasone, which is sort of our standard triplet therapy, or had been our standard triplet therapy. They were randomized to either that VRD or daratumumab added to the bortezomib, lenalidomide, dexamethasone backbone. So these were importantly